Good afternoon, everyone. It's a pleasure to be here. I want you all to know that I have, from Houston, signed and sealed and stamped travel papers that allow me to come to your city, from which I must return by midnight under penalty that the mayor would not tell me what it was. And of course, we all know that we live in the second best cities in Texas. Just ask anyone from Fort Worth. Right? Where the West begins, right? And when you've got the Kimball Museum and everything else in that wonderful city. I once stayed in a B&B in Fort Worth for a meeting and spent the first hour getting up the first morning battling with a scorpion in the sink. They have very hard exoskeletons. They're hard to kill. Then I realized it was his home, not mine, and we made peace. My goal this afternoon is, by fulfilling these objectives, is actually to try to normalize genomic and genetic ethics. I think genomics and genetics are a classic example of a medical specialty that's gotten siloed off from the rest of medicine, and as a consequence has its own discourse, even its own discourse like actionable. No other clinical specialty uses this, for example, and it's gotten actually troubles with the insurance companies because they won't pay for diagnostic workup. They worry about variants of unknown significance. Any of you who've gotten a radiology report is going to have on it, consistent with, right, all these language that radiologists use that have to be interpreted and then shared or not with patients. So I'm going to define ethics, and it's two main tools. We're all on the same page, some core concepts, then the 5 clinical categories into which genome results fall, and they're the exact same categories into which every other clinical results fall, and then an ethical framework for dealing with this in the decision-making process with patients and also with parents. There are some special wrinkles in pediatrics. So what is ethics? It's a very old intellectual and practical undertaking. You find it in global cultures all around the world going back to ancient times. It's the disciplined study of morality. Morality concerns our behavior, how we should act toward each other, and also our character, what virtues we should cultivate so that we're better persons, and what vices we should avoid. So Mr. Trump has the vice of a potty mouth, for example, and I was thinking over the last 72 hours that if my sainted mother, as we Irish refer to our dead, were alive, she would wash his mouth out, not with soap, but with borax. I had that experience once, and I never said that word again until I was an adult, and then I looked around to see if my mother was there. And the way we do this is by ethical analysis, is getting very clear about pertinent ethical concepts, and then identifying their implications for how we should act or how we should form our character so that we give reasoned accounts of what morality should be. And the goal is to improve our morality, that we can be better people, we can have better institutions, we can have a better society if we think together carefully about it and reach judgments about how to improve. Whoops, I don't know what I just did. So what are the key concepts that we need? First is beneficence. This is one of the oldest concepts in the history of medical ethics. It's a simple concept. It says clinicians should provide clinical management for patients that has an evidence base for net clinical benefit. This concept of beneficence was first introduced into the medical ethics literature in 1803 by Thomas Percival in England with exactly that meaning. He was one of the first practitioners of evidence-based medicine in the history of medicine. Then we forgot it in the 19th and early 20th century, and now we have to recover it. We are a remarkably unintelligent species sometimes. We learn stuff, then we forget it and have to relearn it. So you look for deliberative clinical judgment that's evidence-based, that's rigorous, transparent, and accountable, just of the kind we've been seeing in the presentations today, and you make judgments based on that about what will benefit the patient. Professional integrity says you practice medicine or healthcare, teach and conduct research to standards of intellectual and moral excellence. Intellectual excellence is adhering to the discipline of deliberative clinical judgment, and moral excellence is you put the interests of patients and their families first, and you keep self-interest systematically secondary. We use this word patient without being clear what it means. A patient is someone who is presented to a healthcare professional, and there's something that can be done to help, and they don't have to be presented in person. They can be presented at a distance. So a friend of mine has friends in Jerusalem, Israel, who are board certified American radiologists. They just happen to be Israelis, and They are practicing radiology on patients in the United States. The digitized images are sent by a computer to their computers during our night and their day. They interpret the images, write up their reports, and they're ready the next morning for the care of those patients. So they are presented. How are they presented? Through digitized images. In the 18th century, Thomas Percival would have had patients presented to him by sending him letters. So patients frequently wrote to famous doctors and said, here's my story, please send a diagnosis and a treatment plan. And famous doctors would oblige and become more famous if their treatments worked. So it's very easy to become a patient, and it has important implications in genomics. You can be presented through your kinfolk's genome to a doctor. Right? So if I have my genome sequenced, my kinfolk are presented in that, because it's not just about me. They become that analyst's patient, which makes it more complicated, and the way to prevent these ethical problems is to turn the clock back and stop science. Good luck with that alternative.